The health information contained herein is provided for educational purposes only and not intended to replace discussions with a healthcare provider. All decisions regarding patient care must be made with a healthcare provider considering the unique characteristics of the patient. Now, we've arrived at the treatment section. People have expressed that they feel relieved once a lung cancer treatment plan has been established for them. Lung cancer treatment will depend on a few key things, including cancer type, stage, overall health, biomarker test results, and your treatment goals. It's important to share your feelings about your goals with your healthcare team and discuss how to maintain your health and overall quality of life during treatment. When making lung cancer treatment goals, ask yourself two important questions. What are my goals beyond treatment? And how can my healthcare team help me create a realistic plan that achieves these goals? The answer to these questions can help inform a treatment plan that is best for you. Lung cancer is different for everyone, and there are several options for treating it. Now, we'll go over the most common ones. You, your loved ones, and healthcare team will discuss what's best for you, whether it's one treatment or a combination of the following, depending on stage and type. Surgery may be an option, depending on the cancer type, location, stage, and other medical conditions. If someone has lung cancer that can be removed by surgery, this is called resectable. The goal is to remove the tumor. Surgery is the best option when the cancer is localized and unlikely to have spread. Recovering from lung cancer surgery can typically take weeks to months. Before surgery, you may start with a treatment that reduces the size of the tumor first. This is called neoadjuvant therapy. However, after surgery, there may be a chance the cancer could return, progress, or spread. This is called recurrence. To help reduce that risk, other treatments may follow the surgery. This is called adjuvant therapy. Chemotherapy refers to a single drug or a combination of drugs used to destroy or prevent the growth of cancer cells. It is also referred to as systemic therapy because the drug travels through blood to cells all over the body, aka your system. It may be given as a pill or as an infusion into the bloodstream. Radiation therapy uses high-energy X-rays to destroy or damage cancer cells to keep them from growing. Radiation therapy is considered a local treatment and only affects cells in the area where the radiation is focused. Sometimes, chemotherapy and radiation therapy are used together. This is called chemoradiation therapy, or CRT. These can be given at the same time and usually last 6 to 7 weeks. Think of this as two treatments working together in different ways to increase the effects of attacking the cancer cells. Radiation and chemotherapy are treatments that can be used alone, in combination with each other, or with other treatments, such as surgery, targeted therapy, or immunotherapy. Targeted therapy focuses on and targets cancer cells to reduce the risk of lung cancer from coming back or blocking it from growing and/or spreading. Because it's targeted, it's less likely to damage healthy cells. Targeted therapy is usually given orally in pill form. Immunotherapy is a type of treatment that helps your own immune system recognize and destroy cancer cells more effectively, and is usually given as an infusion into the bloodstream. Immunotherapy can be used with chemotherapy as a combined therapy, before or after chemotherapy as a standalone therapy. In addition to the type and stage of lung cancer, biomarker testing may be used to determine if one of these treatments might work for you. Now, there's a lot of enthusiasm around newer cancer therapies, both those that have been recently approved and ones currently making their way through clinical studies. Clinical studies are carefully monitored research studies. Depending on the type of lung cancer you have, a clinical study may be an option for you. Talk with your doctor about whether a clinical study is the right treatment decision as soon as you begin exploring your options. Your treatment plan may also include pain and symptom management. Palliative care, sometimes called supportive care, focuses on the whole person, from physical to psychological burdens. It can be incredibly helpful in managing pain, symptoms, and side effects at any point during treatment. This type of care is provided by a trained team of specialists, like doctors, nurses, and social workers. Palliative care also focuses on reducing stress and anxiety in a variety of ways that can help improve the quality of life for you and your family. A cancer diagnosis can affect emotional health. In addition to changing roles at home, school, and work, it's important to recognize new feelings and express the need for support. It is used at any age and at any stage. Palliative care is not the same as hospice care. Hospice care focuses on the quality of life and compassionate care for people who are in the last phases of their illness. It treats the person and the symptoms of the disease rather than treating the disease itself. When recommending a certain treatment, your doctor will most likely consider data from clinical studies that show how effective that treatment is. Here are some of the terms that you may see and hear. Disease-free survival, DFS, is how long after primary treatment that the patient survives without a sign of that particular cancer. Progression-free survival, PFS, is the length of time during and after treatment that a person lives with the disease without it getting worse. Overall survival, OS, is the length of time from either the date of diagnosis or the start of treatment that people diagnosed with the disease are alive. Remission means the signs and symptoms of cancer have decreased or disappeared. Partial remission is when some, but not all, signs and symptoms of cancer are no longer present. Complete remission, where all signs and symptoms of cancer are no longer detectable, is also called no evidence of disease, or NED. So once again, here's what to know and what you can do. What to know. There are different treatment options with different methods of administration. Options are unique to the type of cancer you have. Palliative care is for everyone, at every stage. What to do? Discuss all treatment options, including the benefits and risks of all treatments available to you. Consider clinical studies. And while it's not always the case, side effects do occur.